Good morning. My name is Geert Peuskens, and I'm presenting a presentation on regional strategic care planning, and the focus is on general hospitals. So it's a bit of a different story than we heard till now. Flanders is a region in Belgium with 6.5 million inhabitants. We have 53 general hospitals on 99 sites and 29,000 hospital beds. If you compare it with other regions in Europe, it's really on the high side. And yearly we invest 200 million in hospital infrastructure. The goals that we want to get with our regional planning is align the care supply to the actual needs of the population and stimulate cooperation between hospitals and other care providers. We want to pool expertise, and particularly for complex pathologies, and also match the expenditure to the financial context and achieve a health economic justifiable offer. To do so, we made a new approach of strategic planning, and so all the hospitals are centered in 14 networks or potential networks, and those 14 networks have to do 4 steps to become to get a regional strategic plan. The first step is they have to make an inventory on population needs and the inventory of the care partners in the region where they are active. They can use demographic figures, but also health indicators and the ratio of hospital admissions in their region. In a second step, they will do a simulation. There were some studies in Belgium about the number of hospital beds that will be needed by 2025, and the conclusion, if you translate it to the level of Flanders, was that there are about 6,000 beds too many in Flanders. And the University of Leuven has figured out and made a tool to see how many beds there are too many in each network that is forming and on the level of each hospital. In a third phase, they have to do a comparison between the current and the required care capacity. And it's beds, but there are also other care programs and so that are included to see what is the gap between what we offer at this moment and what do we have to offer in the future for the needs of our population. And in a fourth step, the hospitals in each network will have to negotiate with each other on which care programs they are going to make and which functions they need to be able to answer the needs of the population. But at this moment also the other care partners in the region will be included in the conversations to see if there are possibilities of changes and less hospitalization and more ambulatory care. We are going to use it to plan and recognize hospital functions, care programs, services, but also for the financing of infrastructure of hospitals. So above you see the figures from our first slide. And where are we going to? Well, we want to go to hospitals of the future. Hospitals of the future are smaller hospitals. You can see we think we need 23,000 beds by 2025, and that there will be a change to more ambulatory care. That can be ambulatory care in the hospitals, but also ambulatory care outside the hospitals and other sorts of care than we know now in Flanders. Hospital of the Future is also a hospital that has a strong focus on technology and highly specialized care, where we try to keep the patients that don't have to be in the hospital out of the hospital. And it's also at the end the phase to consolidate the 14 networks that are creating at this moment. What are the lessons learned at this moment? Well, in 2019, so this year, we are implementing this new way of organizing. So it's really a long process to go, and we see that there are a lot of problems and things we have to adjust. It's also that at this moment there is a focus on the hospitals, but in the far future we want to have all the caretakers in a region sit together and think together about how the regional care plan should be for that region. So that everyone has the same level of interaction and same weight in the decisions that are made. New trends in the cooperation will need also new business models and financing mechanisms. And there, for Belgium, for Flanders, there is a problem because the financing of the hospitals is on the Belgian federal level, while other parts of financing of the healthcare system is on the level of Flanders. So if we gain money by the hospitals, it's not sure that we can use that money for parts of healthcare that are the responsibility of Flanders. And one of the things we need are indicators to optimize to ensure the optimal and cost-efficient hospital and primary care planning, and we have the impression that we lack those indicators at this moment. If there are further questions, here are our emails. The presentation and the poster are at our website, but we have also some copies here, so if you're interested, you can pick up after this session.